Countries along the American continent have stepped up efforts to check borders and airports to prevent the virus from spreading through the region. Gui Xiaozeng has the story.
The U.S. has become the country hardest hit by deadly swine flu after Mexico. More than 40 people in 5 states are sick, over 20 of them in New York City. The U.S. government on Sunday declared a public health emergency. Schools were ordered closed in California and Texas, and Americans have been urged to avoid all non-essential travel to Mexico over the next 3 months. The Department of Homeland Security says inspections are being boosted at borders and airports, while the national stockpile of antiviral drugs is being activated. No deaths have yet been reported. In Colombia, officials increased monitoring and control at hospitals, ports and main airports, especially for people arriving from Mexico City, Texas and California. Health officials say there are 11 suspected cases of swine flu, but all patients are apparently recovering. Passengers arriving from risk areas at the airports are having their baggage inspected, and those with potential flu symptoms are taken to nearby hospitals. In Chile, all passengers arriving from Mexico and the U.S. are checked for flu-like symptoms. Authorities are also warning against trips to risk areas, and border officials are monitoring passengers arriving by land and sea. Similar scenes are taking place in Brazil. Health authorities say they will begin distributing pamphlets describing the swine flu symptoms at the country's main airports. One concern is time that it takes to develop a vaccine.
This is a recently discovered virus, and we know that it takes some months after you identify the virus to have time to develop a vaccine, and this period is usually 6 months. We haven't had time for that yet.
In Peru, passengers arriving from risk regions undergo screening. The health system has also been ordered to watch for an increase in respiratory illnesses and promote vaccinations and preventive hygiene habits among health workers and the public. South American countries have not yet confirmed any cases of the Mexican virus, but dozens of cases are under investigation and preventive measures are increasing by the hour. Gui Xiaozeng, CCTV.
South Korea has confirmed a suspected case of human infection of swine flu. The government has designated swine flu as an infectious livestock disease and allowed authorities to limit movement. Many other countries in Asia and Europe are also trying their best to block the disease. Laurie Liu has more.
The ASEAN Secretariat met with the officials involved prior to coordinating with member countries to prepare precautionary measures to prevent swine flu from spreading. ASEAN has 500,000 courses of antivirals stockpiled in Singapore, and an additional 500,000 courses have been distributed to member states. There are plans to find other sources of antivirals if needed. Spain has announced its first confirmed case of swine flu, the first in Europe. The Spanish Health Ministry identified the patient as a 23-year-old male who returned from Mexico on April 22nd.
We have another 27 that we are waiting for confirmation. These are people who are under control, and they are people whose cases are being studied.
At Madrid's Barajas International Airport, passengers arriving from Mexico are asked to declare where they've been and whether they felt any cold symptoms. They're told to leave contact details. Passengers are also urged to contact health authorities if they notice any symptoms in the next 10 days. And Britain has confirmed its first 2 cases.
I am pleased to say that both individuals are recovering well in hospital. I also can tell you this evening that there are currently a further 7 people among the 22 who had been in contact with the 2 infected people who have now developed mild symptoms and are being appropriately cared for.
France has warned its citizens against non-essential travel to Mexico. Reinforced checks are set at airports, especially for people returning from Mexico. Russia says passengers from North America running a fever will be quarantined until the cause is determined.
We are looking at flights from New York and Los Angeles and the transit flight from Mexico via London and Paris, which arrives today. Actually, today we will have 7 flights, and on all of these there will be 13 transit passengers.
Airline staff will screen passengers before they disembark. If symptoms are found, medical staff will immediately be contacted so that suspected cases can be isolated.
Meanwhile, the Hong Kong Special Administration has upgraded its swine flu alert level to serious. Patients showing possible signs of swine flu must be reported to authorities. Hong Kong Chief Executive Donald Tsang has asked the SAR government to make full preparations to prevent the disease from reaching Hong Kong. Tsang is calling on residents to be aware of the dangers of the virus. Hong Kong's health authority says 3 residents have been tested for swine flu. 2 of them have just returned from Mexico and the other has come back from San Francisco. Many travel agencies in Hong Kong have cancelled tours to Mexico.
Mexican ambassador to China, Jorge Guajardo, says his country is considering accepting China's help in fighting swine flu. Guajardo says Mexico received a phone call from the corresponding Chinese department offering help. It says the Mexican government would like to take help from the world. The ambassador knows China has the experience of fighting SARS. Guajardo says the government is confident and capable of bringing the situation under control as soon as possible. So far, over 1,000 of the 1,600 suspected or confirmed cases in Mexico have been cured. The country will set up a special group to help release information and simplify procedures for the inbound transport of medical staff and equipment.